For about a year when my wife was pregnant and whatnot, I started feeling off. I didn't feel right, but I didn't really think much about it too much. I thought I was just getting older. I finally went in when it was just too much. When my son was born, it was just too much. I couldn't handle anymore, having trouble sitting up, having trouble going to the restroom. When you realize that you can't even pick up your 9-pound baby, something's wrong. Something is severely wrong. And they found cancer.
Being with patients when they're kind of at one of the most challenging times in their lives, you get to be a part of that. You get to know the patient, you get to know their family, you get to walk along with them during their journey.
When you find out that everything you've been feeling for a year was cancer, your immediately thought is like, I'm a year into this.
It's basically surrounding the patient like a big hug in a way, in that you have people there to help with a plan that we know works, and making sure that their desires are put up front in a very compassionate, graceful, and respectful way.
Compassion, to me, means that we are there for patients through their toughest times, and we do our best to alleviate the challenges that they are facing. And I spend a lot of time just listening to where they are, what their priorities are, what are they most afraid of, and how we can help them through this process and cure them. If not, at least we can care for them.
The healing effect of relationships that patients have with their doctors and nurses is tremendous. And I want to build upon the healing effect of those relationships. The new cancer center that we're developing will have integrative medicine built into the cancer center, where we bring, along with the cutting-edge anti-cancer treatment, all the complementary services such as acupuncture, chiropractic care, osteopathic manipulation, music therapy, art therapy. All of that will help surround the patient with a healing environment.
Nursing One was always very, very good about making sure that any fears that could be thrown to the side are, because they can't stop you from being scared of having cancer, but they can stop you from the fear of not knowing.
It is absolutely vital for us for the work that we are doing to raise money for the Mercy One Richard Deming Cancer Center, to build compassionate care as a focus on what we do, because I think that is the seed from which the various aspects of care emanate and spread.
As a cancer center director, my goal is to make sure that every patient, as they come through the cancer journey, are surrounded with support and compassion every step along the way, so that they're likely to come out the other end of the journey with this sense of post-traumatic growth and with the ability to tap into their strength, which is called resiliency.
If nothing else, every single person that works here works together to make sure that each person that walks in here feels like they are the center of the universe, like they are going to get every treatment they can. We call it customer service, and everywhere else here, it's really patient service, and it's fantastic.